People are dynamic and amazing, and I'm always in awe of the cool ways that they grow. Something that I find particularly interesting is the patterns in which they grow, and the ways in which I, as a provider, and the way that patients perceived their growth. When we imagine growing, I think we imagine it going something like this. How we expect personal progress to happen. Where at some point we start making progress, we're successful when progress steadily increases over time, and we reach and maintain mastery. For some time, I began to appreciate that progress in any area looks more like this. There is a time and relative plateau of function that existed before the person decided that they needed to make progress. There's a point where they gain new tools and make lots of progress, and then there is a time of slower, and if the person is persistent, long and slow progress toward perfection. From week to week with my rating tools that patients use to assess their progress in an area, the patients, and sometimes me too, became a little discouraged or underwhelmed by what seemed to be the oscillatory aspects of personal progress. It felt like progress was going like this, with steep ups and downs, without sustained gains in progress. This, of course, wasn't true. After great reflection and discussion with colleagues, a pattern of progress became apparent that did, in fact, have plateaus and inclines in function, but also had oscillations with inflections and depressions that greatly impacted the morale of the person that's growing/changing and the perception of the person providing care. This model of personal progress looks more like this. My observation is that personal progress is more like this. And when you zoom in, crucial points emerge. It's important for both the therapist and the patient or client to appreciate objective data, progress, and SMART goals, in order to benchmark gross, long-term progress along the larger curve, but these points that represent acute success and failure must be appreciated as well, because the subjective feelings of success and failure in these moments that the therapist and client may feel impact accurate assessment of success, motivation, and consequently, the therapeutic or coaching process.